and Brad, the two most famous physical therapists on the internet.
We're ready to go, aren't we, Brad?
Yeah.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today you want to talk about how to correct and measure head-forward posture. I think that's a good idea. People need to know where their head is at.
Right.
And they need to know if they're improving.
Yeah, exactly. I had a patient, she came in, the doctor said, boy, you really got poor posture and maybe you should improve it. And she realized it and her head is like this. And so she was motivated to get more upright because she didn't want to get worse and worse as
which causes all sorts of problems.
Exactly.
Right.
So I thought, well, we got to measure this first,
Okay.
show her some exercises, and then come back and measure again to see progress.
I can't wait.
All right. Bob, why don't you put your back up
Okay,
against
so
the wall.
we need a wall first.
Yep. You got a good angle here, Lonnie. So here's the point.
Are you directly on, Lonnie?
Yeah, but
You might want to, okay.
she thinks she does. Okay,
right.
The sacrum should be touching that part of your back right below the
Right
belt.
here, below the belt.
So that's touching.
Up against the wall.
Keep your feet about 6 inches, a foot away from the wall. So you're leaning into the wall. Your back should be touching here. Okay, now your head forward posture. So this is about what this woman looked like. And you'll see this if you look around for people. And so I said, can you bring your head back and touch this part of your head, not the top of your head, but this part of your head to the wall as best you can. There you go. And that's as far as you can get, right, Bob? Mm-hmm. And this is about how far that she could get, actually. You take a ruler and just measure and eyeball it in here. You're 3 inches from the wall. And that's as far as it went. And I actually pushed like this, and I couldn't really get too much farther. It was a little spongy, so I knew she had some stretch there, but we need to work on it. Okay, so you write down your dimension, and then you're done.
Okay.
Now the exercises. We're going to go back to the old famous chin tucks. We've had many videos on these because these work for a lot of different problems.
Very important.
Yep. So seated in the chair, I want you to scoot your bottom back in the chair, Bob.
So I'm here.
All the way back. Best posture you can. And now you're going to bring a chin tuck in and back. Now, do a chin tuck like a lot of people do. That's not correct. Yeah, they start to look down or they start to look up towards the ceiling. It's straight
back.
in. And this can be hard for some people to grasp.
A lot of people have trouble with this.
Right. And
It's like you're backing up a vehicle here.
Yeah, exactly. You should feel.
I'm sorry.
You should feel a little stretch back in here. It should create no sharp pain, just that stretch pain.
Throw the pie in my face, Brad.
Yeah. So it's like this, and back. It's kind of fun. Keep going. It's like a yo-yo. Anyways.
Then some people do the overpressure. Do you want to talk about that now? Or?
Yeah, that's a good point,
Sure.
Bob. Go ahead.
A lot of times people will do overpressure. You can take the thumb right here, or in between the thumb and the finger, and just push back a little bit. Some people just go like this with a couple of fingers.
Yep.
And start giving a little bit of stretch. Pressure on, pressure off.
Good.
Pressure on.
I think that's a good way to think about it.
Pressure on, pressure off.
About 10 times is good enough. Do that about 3 to 5 times per day. Now, you can do it standing as well. And with this particular person, she really had a hard time, like Bob said a lot of people do. So I said, we got to get through this. And she had a walker. She was a little off balance. So doing this standing was a little wobbly for her. So I said, well, let's just go back to the measuring point. Bring your walker right in front of you. Hold on to here. So she felt very steady. And I said, just try to touch this part of your head to the wall. Not the top, so you're doing this, but it's the lower part of your head. What's that called? The Indian. The Indian. I always called it the onion, but it's really the Indian, if you want to look that up in your anatomy book. And she could do very well then. I put her up there.
So what's nice about this, you can actually push off a little bit on this, right?
Yep, and the shoulders go back. It's a really good postural exercise as well as head forward posture.
The point about this exercise, Brad, is not only is it training you, but it's also a reminder. It's a reminder of where you should be.
Exactly.
So you can do these throughout the day just to do a few, and like, oh, that's where my head's supposed to be, not here.
Yep. Yep, it's that kind of that muscle memory they talk about. Maybe not exactly, but it's in that.
No, that's the problem with it, is after a while, this feels normal.
Sure.
And then you don't notice until you see yourself in a picture and you go, oh my God. And this feels abnormal. This feels like you're really exaggerating going up.
Right, exactly. We've got one more position to talk about, and that's laying down in bed, chin tucks, as well as pillow posture.
I think she cut you off. Are you ready to start again? Oh, you started. Okay.
We're going?
Yeah.
Okay. So you can do the same exercise here. The head will be up a little bit. You let your head, let gravity do the work here, and then do your chin tucks here. Now, if you really have serious head forward posture like this woman, her head would never, she could never tolerate this. And what I found out with her is she's using a very thick pillow at home. And the pillow is actually forcing her head forward. So I said, get a thinner pillow. And so this is a real thick pillow. So she's going to get a pillow half that thickness.
And some people just use a rolled towel to start off
Yep,
with, right?
and you can do that. Anything to help get
Roll
that
taller
posture
sheet.
back. Oh, Bob, I think I'm going to take a nap. My head forward posture is improving already.
So do a few chin tucks with
Oh,
that in
sure.
place, Brad, 'cause
Okay,
that,
so
that shows you again how
there we
you
go.
work on it. So
Good point, Bob. Now, with this woman, every week she's going to do exercise. I'm going to go back to the wall and I'm going to measure. And then I'm sure she's going to make some progress. I don't know. She's in her 80s. She may not get all the way up, but at least it's
Right.
going to improve.
Exactly.
And eliminate the worsening of it.
and also hopefully decrease pain issues. and stuff like
Exactly.
that. So, all right.
All right.
Thanks for watching.
Head forward.